Yeah. I may not be on Monday either,
Next
because
week.
it's my husband's birthday, so I think we're out.
Oh, okay. Happy birthday to your husband.
Thank you.
How are you doing?
Okay. Oh, my back, it's better. I have discovered that walking on soft sand along the ocean in my shoes really seems to be the silver bullet.
Oh,
Uh,
really?
yeah,
Great.
I think walking on cement or any hard surface just kills my back afterwards. I have to stop, but I can do 3 miles now without a problem.
Right. Hmm. That's fantastic. I'm glad to hear that.
Yeah, it's much easier on my back, and it gets the blood flowing, and yeah,
Good. And you've obviously gotten stronger too, so I'm sure that's probably helping you as well.
yeah.
Good. Okay. So we're going to get started here. So today is going to be a little bit of a continuation of some positions and some new exercises from last week. So we're going to start in quadruped again. I love quadruped, so we're going to start in quadruped, and Amanda is going to go ahead and start doing some pelvic rocks. The cat camel. It's always trying to find a name for this. Cow cat, cat camel. So back and forth. And she's actually gotten better with this. Her excursion has gotten a lot more. And let me just see yours so I can see. And yours looks pretty good too, Ellen. So try to incorporate your breath. So as you arch your back in this inhale, all the way down, inhale. And as you arch like a cat, exhale, blow it out. Good. Inhale. And exhale as you arch like a cat. Good. Inhale. And exhale as you arch like a cat. Now do it one more time. And right back to the middle. Good. Now find neutral spine. And then what we're going to do here is just take a few deep inhales, exhales, maintain your position here for a few breaths. Maintain position of your neutral spine, meaning right in the middle. So not arched like a cat or like the camel, nor arched like the cat, nor rounded like the cat. Just right in the middle, taking deep breaths. Good. So right in the middle, and we're going to do a new one today. In fact, we forgot to put the TheraBand on. So for this first one, in fact, let's do one set without the TheraBand, and the second one we'll do with the TheraBand. What we want to see is maintaining this neutral position. So I'm going to put that stick there for her as she's doing a hydrant, which we've done the hydrant on our side. Now we're going to do it in a quadruped position. So you have to unweight the legs first and then bring it out. Let's do one at a time just to make it easier for you, Amanda. Good. So keep that stick or keep that neutral spine right in the middle, and then take that leg straight out to the side and back. And in order for her to keep that spine in neutral, she has to work really hard and control her pelvis and her hips, which is going to emphasize the trunk stabilizers and obviously the gluteal muscles, specifically her gluteus medius. Good. And the stronger she is, the more of an excursion she's going to get through here. Let's see what you have. Good, Ellen. That looks pretty good. So when you unweight that leg, you should feel a lot of work happening through your core and your back muscles and your hip muscles to keep that spine in neutral. Looks pretty good. So let's do a couple more. I think the handout says a set of 15. We're going to do the first set without the TheraBand. The second set we're going to do with the TheraBand. We'll see how Amanda does. Do a couple more. So you feel, if you keep the spine in neutral, you don't have to go out very far before you start to feel those muscles really engage. Okay, take a little pause, and then we're going to go to the other side, do 15 more. When you come back down, when you bring the leg down from hydrant, don't necessarily put it all the way down. Maybe just tap it on the ground or the carpet or the mat that you're on. That way it doesn't get stuck. Because then you have to unstick it and then lift it. And that can create, more forced exertion as well as some friction. There, good. So you're almost hiking it up into the socket. That looks better. And already you see her speed is better. However, she's starting to tilt through here. So I'm going to bring her back there and have her maintain that. Good, Ellen.
Do you bring the leg to the other, do you bring the knee to the other knee?
Pretty close to it, but try not to touch the ground. Just hover that knee,
Right.
the right knee in this case, just
Right.
above the mat. So pretty close to the opposite knee, but hovered above the ground so that you're not creating that friction and having to unstick the leg before you take it up again. How many is that, Amanda?
One more.
Okay. Okay, good. Take a pause, let your wrists stretch. And then if you want to grab your TheraBand, if you have it there, put the TheraBand just above the knees again, just like you would if you were doing a side lying clam or hydrant. Okay. Let me know when you're ready, Ellen. We'll get you started.
Oh, okay. Here. Okay, I'm ready.
Okay, so back to neutral. If you want to do a couple cat camels and find your neutral position, again, very, very important. I keep going back to that because I think it's very important to establish that concept of finding it, and not only finding it, but also holding it in place as you're doing your exercise, because that's going to give you maximal activation of those muscles and control. Good. And then find that, remember that finding it is that middle ground between the cat and the camel. Okay, so now she's got resistance. Again, you're hovering. Just the fact that you're not bringing the knee, the left knee in this case, down all the way is going to make her work. And the TheraBand is just adding another kind of level of intensity to the exercise. Again, really neutral through that spine, really pulling in through her core. All the concepts we've learned from the beginning class incorporated here. Slow control, abdominals pulled in, maintaining your form with the other body parts that are not supposed to be moving. That's 15. Okay, and you should really feel that, Ellen, on your side hip, not only on the left one, but also on the right one, because the right one's also working to stabilize.
Yes.
Once you reach 15, then switch legs, go to the other side. Again, find your neutral spot or neutral spine and maintain it as you're moving through and go through your 15. Good, Amanda. Looks good. Much more stable. However, I'm going to correct her a little bit. She's kind of tilting a little bit there. Now maintain that there. That'll make a difference. You won't be able to. And right when you do that, I feel the abdominal really firing on this side. So that's good. So I know you're getting your core working here, as well as obviously that glute on that right side. Good. And once you've gotten to 15, or once and just rest in child pose. It's your little recovery period. Rest up there for about a minute, and then we're going to do a similar position in quadruped. We're going to go arms. Say it again. No, you don't need it for the next one. So for the next one, you don't need the TheraBand, Ellen, if you want to take that off.
Okay.
Okay, so this is driving. There's a thing called drivers. Drivers are body parts or body movements that are creating a force that your trunk has to stabilize against. And right now the driver is going to be her arm and her shoulder blade. And what she's going to do is she's going to, again, find neutral spine. So if you want to go through that process, okay, she went through it. Right in the middle, she's going to take her left arm so that you can see it, Ellen, and she's going to drive the elbow toward the ceiling, and then she's going to rotate her trunk as far as she can without moving her pelvis. Let me point to her pelvis right here. So this is going to stay stable. The movement is coming from above that all the way to her shoulder and then come back down. Good. And then reach under like you're reaching toward the wall, Amanda. Good. And here again, reach as far as you can without moving the lumbar spine. So you've already gone too far. Good. Now drive that arm up and rotate toward the ceiling on the left. Good. As far as you can. And then again, drive it underneath you like you're threading the needle toward the right side of your body. Yeah, don't go down. Don't dip down. Just create the rotation through your upper thoracic or upper back area. Drive that elbow back without rotating that pelvis or the lumbar spine, lower back, and then drive and thread the needle through. She's doing 15 of these. So again, the whole concept here is maintaining that mid-lumbar lower back section perfectly stable right through here as she's driving and using the arm, the scapula as her driver to try to destabilize her lower back and abdominal area. So she's got to, in order to maintain that spine in neutral, she's got to really use her core and her abdominal muscles as she's creating rotation through her upper back, which is a nice combination of creating rotation through the thoracic, but stability and strength through the lumbar, which is a common pattern that we try to attain here in the clinic. Most people's upper back thoracic area is too stiff, so we try to get movement. And most people's core and lower back is weak, so we try to stabilize. Once you've reached 15, then we're going to switch, and I'm going to take a look at what you're doing, Ellen. Good, and reach through, Ellen. Good, but reach only as far as you can without moving that lumbar spine. Good. Do one more. Good. And then go ahead and switch sides, Ellen. Good. Find that neutral spine again so that you don't lose it. And just be careful when you are, now you're doing the right hand, the left hand, which is stabilizing on the ground, should be working as well. So don't just dump down into the shoulder and just kind of go into a kind of hanging on ligaments. You want to be able to work with that left arm right now as you're driving and using that arm as your driver to destabilize. Good. So right now you should be feeling the back of that left shoulder, Ellen, the stretching of your upper thoracic area and the stability of your muscles, of the muscles working through your core and lumbar spine. Good. So again, a nice exercise, which is combining mobility that we want in the upper back, but we want the strength and the stability in the lower back and core area. Okay, take a little pause if your wrists are getting tired, child pose, or just get out of that position. We're going to do one more set. So again, this one is a little tricky, Ellen. You may not feel it initially because there's a lot of moving parts that you have to control. But again, a really nice one to create mobility in one part of your back, but stability and strength in another part of your back.
Huh.
Again, everything is about form. Now, I've never seen you in person, so I don't know if your thoracic spine moves well. It looks like it moves pretty well based on what I'm seeing.
Yeah, I've never had any problems with the thoracic spine.
Yep. The common pattern is a lot of people are really stiff there. There's a lot of people that sit in front of a computer and don't move very much, so it creates tightness there. Okay, let's set it up again. Let's go quickly through 15 more on each side. So two sets of 15. Now that you have the pattern down, really focus on stabilizing the sections of your body that should not be moving. Lumbar spine, and really stable right now through your right shoulder and arm, Amanda. Good. 1, 2, 4. Much better, Amanda. So good rotation through the thoracic spine. Not much going on here, which is really good. So that means that her abdominals are really working to prevent that rotation through her lower back. Thread the needle and good.
The other side?
Yep, once you've gotten to 15, then go other side. And just try to notice when you start to get nitpicky at this, which side can you rotate more on? You might have one side that's stiffer, you might be able to rotate more in one direction versus the other. Which one do you have a harder time maintaining that lower back in a neutral, stable position? It looks like this side on you, Ellen, is stiffer. I don't know. I don't see as much movement through your upper back on this one.
Let me turn around. I think it's about the same.
About the same. Rotate, 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 rotate. Good. And reach. And rotate, rotate. Couple more. And make sure that left arm right now is working pretty hard there, Ellen, to maintain you stable. And good. Take a break. Good work. Child pose if you need. Okay. In keeping with trying to work in different planes, we're going to go on your side now. For the next one, you may need the TheraBand, probably just above the knee, for side plank with combined hydrant, which is one that we did in the previous class, but it's always a really nice one to come back to. So I think it's really, really effective at strengthening your core as well as your hips simultaneously. Okay. And remember this one, if you have a bad shoulder, Ellen, and you don't want to put so much pressure on it, then maybe don't lift your hips up. You can get a lot of work done with keeping your hips down. If you want to go into that side plank and unweight your hips, go ahead and go in there now. There you go.
You mean like that?
Yeah, are your hips up there? So maintain that there as you're doing a hydrant. Okay, so this is a hydrant. To unweight your feet, Amanda. So both your feet and your knee open at the same time for hydrant. Go ahead.
Oh.
There, good. Yeah.
Oh gosh.
Clams is much easier. Clams is much easier. If you can only do clam, that's fine, guys. If you can only do clams, that's fine, because this is a lot harder. Once you unweight the full leg, that's a longer lever arm, more weight for your trunk and your pelvis to have to stabilize against as it's moving through gravity.
Is this okay?
So, looks good. Looks good. You move your knee and your foot at the same time up and down, Ellen. There you go. Don't create any rotation. Okay. Let's go to the other side. Yeah. And this one I put on the sheet between 10 and 15 because I know this one is harder. And I'm only going to have you guys do one rep on this one. Okay. Or one set. 2, 3. Open that foot up a little wider so it moves with, there you go, Ellen. So it moves with the knee. The foot moves with the knee. Try not to create any rotation at all through your pelvis and your hip.
So this kind of takes the place of the side plank, doesn't it?
It can. It can be a progression. Yeah, it can be a progression so that you're working more, dynamically, those side plank stabilizers, as well as now you're strengthening your side gluteal muscles, your glute med and glute max specifically. Okay. All right, let's turn to your back and we can stretch this one out. And again, our piriformis stretch, which we've done before. Get in the way. Okay. Yeah, you're done with the TheraBand, so you can put that off to the side, cross, and then pull that thigh toward you. Yeah, and again, after you've done that side plank with hydrant, it really feels good to do this. And again, normal stretch time, anywhere from 30 seconds to 90 seconds, minute and a half. Longer if you feel like you really like to stretch.
Does the leg have to be a tabletop, or can I let it flop like this?
You can let it flop. Yeah, I'm not worried about that. You want to relax so that the muscle can really stretch. All right, once you've done at least 30 to a minute on that stretch, we're going to do Amanda's favorite finisher. We're going to go through planks. And let's see how far you become. Remember, a lot of these, if you've been consistent with all these exercises that I've given you, even if you're not doing the planks like we're about to do now, your planks should actually get better because you're strengthening all those core and hip muscles. So we'll see how we do. I put on the handout for a minute, but if you can go longer, we can go longer. Okay, so remember this class, which is next week, is our last session. We want to see about a minute and a half on the planks off of your knees. So I'm going to time you, Amanda. Let me know when you're ready. Ellen, you ready?
Yep.
Okay, go.
Is it okay?
Ellen, drop your hips a little bit toward the ground. Perfect, right there. And then keep that little tuck of your pelvis. Perfect, okay? Which is nice for you because I think you said you have stenosis, so it's opening up your spine, but it's still really working those abdominal muscles. And again, push that ground away from you so that you feel those shoulder muscles and scapular muscles really working. So again, it's not just for your abdominals here, it's for your shoulders as well. Really nice shoulder workout here. You guys are over halfway there to get to a minute. Again, I'll leave it up to you guys to see how long you guys want to hold it. We are doing 2 to 3 reps. Okay. So you guys are 5 seconds away from 1 minute. So if you want to go long this time, make this one your long one because it's only going to get harder from here. Okay, you're at a minute and 15 seconds now. Minute 20 seconds done. You're going to make it, Amanda. 5, 4, 3, 2, 1, and down. Nice work. So right now, the position that Amanda assumed was on her stomach, but she was kind of in a prone on elbows. So she can either do child pose. I put on the sheet an upward facing dog, which is a yoga pose, or a prone on elbows. Now, Ellen, be careful when you do those. If you do them and they're causing pain, then back off. I know you said you have stenosis, so those sometimes will close and compress your spine a little bit more than you'd like with somebody with stenosis, but sometimes it may actually feel good. Like I said, stenosis has a pretty mixed bag of position tolerances. So sometimes a position that we think is going to bother you actually feels pretty good.
Yeah.
So just kind of base it on what your pain is telling you. Yep. So if you look at the camera really quickly, Ellen, this is a nice stretch for your abdominals. You're kind of arching back, prone on elbows.
I don't think I can do it.
Yep, that's fine. No problem. I'm just giving you an option. It's always there for you if you need.
Well, I could do maybe like this.
Are you flat on your stomach? And that's fine. Sometimes that's the starting position. And then we work our way out from there into more of an extension. Okay, yeah, 10 more seconds and we'll get started with the second set. Okay, so we're only going to do 2 sets today, okay, because we are trying to go for a minute and a half on both of them. Okay, which if you make it, you've already, I think, Ellen, you did a minute and a half, so you've already met one of the goals that we set forth for this class. Okay, you ready? Okay, guys, when you're ready, go ahead and start. Leave it on. You drive home.
Are you in the studio doing this?
We're in the clinic, yeah.
The clinic?
Yep. We're in one of our rooms. The lighting tends to be really good here, and it's away from the patients, so we have some privacy.
Are you seeing patients now?
Yeah, we've been open the whole time. We've never closed.
Oh, really?
Yeah, it was starting to come back, but it's been very slow. So we've had like 3 very slow months. We had to modify hours and, only have 1 therapist here per day just to take care of the patients that needed to come in. You're almost at a minute. Okay, you're at a minute right now. Okay, so Amanda took a break. Her arms started fatiguing out. So Amanda, actually, her core is fairly strong, but her arms tend to give out on her. So that's something that she needs to work on. Okay, that's where I would be focusing. You okay, Ellen?
Yeah, my arms are hurting, but I repositioned them.
Okay, so just, again, make sure it's not painful. And you're about 5 seconds away. 5, 4, 3, 2, 1, and done. You look pretty strong there. You probably could have kept going. All right. Very nice, Ellen. And drop to child pose or prone on elbows, whatever your comfort level is, and just stretch it out. Remember, you're always trying to cool down and stretch after you've done this. Remember when you're doing stuff like plank sit, you're always breathing. You're always trying to really focus on your breath, especially when it starts to hurt and you start to get really fatigued. Focusing on your breath is a really nice technique to take your mind off of the area that's really uncomfortable and sometimes painful, and focus on your breath. Okay, I'm going to finish here. We're right at 5 o'clock.
Great, thank you.
Yeah, say it again. Yeah. Ellen, if you can communicate with Amanda next week, if Monday doesn't work for you and you're our only participant, maybe we can reschedule it to meet your needs.
Oh, so I communicate with you, Amanda?
Yeah.
How do I do that?
Does Ellen have your email?
If she responds to the recordings, I get it. Or
Okay.
confirmation.
If you respond to the recording that she's going to send you, then she'll get that. And just let her know what your status is for next week.
Okay.
And then you guys can coordinate from there.
Oh, okay. Okay.
All right, Ellen.
Thanks so
Absolutely.
much.
Nice job. Good job.
Thanks. Bye-bye.